This is Dr. Vicki Peterson, founder of Health Now Medical Center and co-author of the book, The Gluten Effect. The question today comes from a woman who knows she's sensitive to gluten based on how she feels and her reactions to it. She's pretty much convinced herself of that. But when she went to her doctor asking for a test and to get some corroboration, her doctor looked at her, she's overweight, and said that's impossible because you're fat. And she wrote to me with a bit of exasperation, wondering what's the deal? Why is it that something she knows to be true is being negated by her doctor based on her weight? It goes back to the classic celiac diagnosis that health professionals are trained in when they go to school. And as I've mentioned before, celiac concerns 1% of the population. That's the amount it's affecting, while gluten sensitivity affects 40% of the population. The classic celiac, first of all, tends to suffer for about a decade before they're diagnosed, and the presenting patient is usually quite underweight. They're actually wasting away, and they usually have severe digestive complaints, and that's how it's diagnosed, as someone who almost appears to be dying from a serious problem such as cancer, and they're delighted to find out that with a simple change in diet, they regain their health and strength. But it is that presenting picture of someone who's quite emaciated and underweight. And unfortunately, doctors are not quite up to speed on the whole gluten sensitivity issue, and they miss it in their patients. Considering the statistics are that 60% of adult Americans are overweight and 18% of our children are overweight, you can imagine the millions of people actually who are gluten sensitive, and their doctors won't even consider it based on their weight alone. So how does it happen with gluten sensitivity that the body becomes overweight? First of all, the small intestine, the surface area of it is the size of a tennis court, which is quite large, and we have 23 feet of small intestine. It's just when they're flattened out, that surface area then is the size of a tennis court. And due to the inflammation being created by gluten, there is malabsorption of nutrients. So that small intestine that's designed to absorb our nutrients, break them down efficiently, absorb them, take them out into the bloodstream, and then deliver it to the trillions of cells that we have so all those cells can eat and thereby perform their jobs, that's not happening. So what happens from the cell's perspective is it's starving. The food is coming in the mouth, but it's not efficiently getting to our cells. And because the cells are starving, not getting fed proper nutrition, their feedback mechanism tells the body to really lower the metabolic rate because they're not getting enough to eat, so there obviously must not be enough to eat. That's what they presume is happening, and the metabolic rate goes very low. These people are not necessarily eating a tremendous amount, but what they do eat just keeps enlarging their body. So that's one mechanism of how gluten sensitivity can cause obesity. The other mechanism has to do with the stress gland. You have a lot of inflammation in the intestine, as we mentioned. Your adrenal gland, in response to that inflammation, makes more cortisol, and cortisol causes weight gain, particularly around the midsection, not solely there, but particularly there. And this sort of weight is very unresponsive to exercise and decreasing caloric intake, and people get very frustrated because they feel like they're doing the right thing, but they still don't see the change in the scale. And it's because of the gluten creating the inflammation and the adrenal response in relation to that and keeping the weight. The other thing that happens when the adrenal glands are stressed is fatigue increases, sleep quality decreases, our metabolic rate actually gets revved up at night. If you're not having good sleep quality, you will gain weight. If you're not in a deep sleep for enough hours at night, you will gain weight. And of course, if you're tired during the day, you don't want to exercise. So that's a negative as well. Lastly, what happens is gluten creates stress on the thyroid gland. The thyroid and the adrenal glands are kissing cousins, if you will. They're in that same endocrine system part of your body. So what gluten does, there's an autoimmune response where it affects thyroid function, and the thyroid dictates our metabolic rate. So we have a lot of different issues coming together, really sabotaging somebody's ability to lose weight. And it's something we really need to be aware of, because if you go to your practitioner, you have weight to lose, and you bring up the question of gluten sensitivity, sometimes you're looked at as if you don't really know what you're talking about, because they're in a bit of a narrow scope, thinking celiac and thinking emaciation and someone who looks like they're wasting away, and if you're not in that category, it can be missed. So I hope that helps, and until next time, I wish you very good health.